Hello, everyone. This is Marilia from Marcus Evans. Thank you all for joining today's webinar, Medicaid, Medicare, and the Reimbursement Reset. The CEO Strategies for Growth, Stability, and Transformation, brought to you in partnership with Signal Health. Before we begin, I would like to cover a few housekeeping items. As you can see at the bottom of your screen are multiple application widgets that you can use. All the widgets are resizable and movable, so please feel free to move around. If you have any questions during the webinar, please submit them in the Q&A widget. We'll try to answer as many questions as possible. However, if we run out of time, we'll make sure to answer to you by email. If you have any issues navigating the platform, please click on the help widget. It will help you navigate better and also showcase you what resources or what other tricks that you can do to connect better. If at any point you need to leave the webcast, you can still watch it in on demand. It will be available to you after 2 to 3 hours, and you will receive an email with login details. Also, if you have any inquiries and you want to directly book a meeting with Signet Health, we can provide you with any contact information, and you can book on the book a meeting widget. We also uploaded a great PDF files for the resources that you are free to download at any moment. I will also mention the agenda of today's webinar. We will proceed with some introductions and inform you about the panelists' overview, their responsibilities, and their position within the industry, a short overview on Signet Health, and then we will proceed with a direct panel discussion, leaving some time for Q&As. At this point, I will briefly introduce our moderator today. We have Joy Piraski, President and CEO at Signet Health. Joy, you can take the stand.
Hello, thank you so much. Welcome, everybody. It's really nice to be here today. As you heard, I'm Joy Piraski. I have the humble pleasure of being CEO of Signet Health. And we'll talk a little bit about Signet, but we're very mission driven. Our mission is to advocate for the vulnerable when they cannot advocate for themselves. So this is a topic I feel extremely passionate about, and we're really honored today to have two really internationally renowned panelists. So I'd like to first introduce Michelle Skolnicki. Michelle is the Senior Vice President and Chief Nursing Officer at Penn State Health Milton and Hershey Medical Center. Michelle is a healthcare board certified senior executive, has multiple experiences, both as a nurse leader and an executive, and so brings that to our team today. So welcome, Michelle.
Thank you very much. Thanks so much for having me here today.
Is there anything you would like to share about yourself? If certainly.
No, I'm just looking forward to getting to the conversation because the financial headwinds of Medicaid, Medicare, and the reimbursement that we'll be facing is something that's very much on all of our minds. So this is a great discussion for today.
Well, we're really so honored that you could take the time to join us and look forward to hearing your perspective. I also would then like to introduce Michael Dowling, who's the CEO Emeritus at Northwell Health and the author of several books on leadership in healthcare. I was just telling him before this, I just finished reading After the Roof Caved In, and now I'm going to start Healthcare Reboot, which really is very apropos to today. So Michael, welcome. If you'd like to say hello to the group.
Thank you very much, Joy. I'm delighted to be here. Thank you for the invite. I've been at Northwell about 30 years. I was CEO for 24 years. As people probably know, we're the largest provider of healthcare in New York State, and we're the largest private employer in New York State. We're a big academic, teaching, and clinical organization. I stepped down as CEO in October of last year. So I now have the title of CEO Emeritus, which means I'm still coming to work every day. I'm still, helping as much as I possibly can. But I'm not in the lead seat anymore, which is nice actually after 24 years of sitting in the major chair. So I'm delighted to be here and looking forward to the discussion.
Thank you both so much. Really look forward to your perspectives so that I can learn as well as the group. To give you a very short introduction about Signet Health, and our mission, as I said, is advocating for the vulnerable when they cannot advocate for themselves. That's what drives us first and foremost with our hospital partners every day as we make decisions, both short-term and long-term strategic planning. We've been doing this for over 25 years. We work with partners all over the United States. And so we get to see lots of different models of healthcare change, of governmental funding as things are evolving for all of us every day. And our goal is to help drive efficiency and enhance patient care solutions. We do this in a variety of ways. We work with hospital partners in both behavioral health, physical rehabilitation, and addiction services. We know that behavioral health can work financially with governmental reimbursement, and that really does depend on specific states and program requirements. So I'll leave it at that, but that really does change, as you all know, really state by state. And so we really specialize in studying it as it's changing, and then helping partners figure out how to provide the care. ED boarding, we know, I hear it over and over and over again, is extremely costly. Behavioral health patients may incur $2,000 plus a day while awaiting some type of placement, whatever that's going to be. So investing in that in a way that's efficient in care delivery is really what makes sense. We know that Gero's psychiatry represents a significant growth opportunity. Right, again, before you got on, I was talking to Michael, and he was talking about, one of his books really focusing on older adults and geriatric care. We know that it's really being driven by an aging population. More than 11,000 plus people turn 65 and older, every single day, and are primarily supported by governmental reimbursement. Acute physical rehab, we know that it can be a highly attractive and financially desirable service line with a growing senior population. A lot of it, when we look at it, it's very different than behavioral health because a lot of these patients are already in your hospitals. Some of them wind up leaving to go elsewhere for care, and we see that a lot. That's something we really help analyze. And providing good care in a physical rehabilitation specialized unit can really help with the length of stay in other parts of your system when that's done correctly. We know that as bundled payments continue to expand, health systems with 100% owned inpatient acute physical rehab programs are much better positioned to manage the costs overall and really improve care and care coordination and keep the revenue in your system. Our values, we talked about our mission. Our values are extremely important to us, and we wind up partnering with systems who have similar values where there's synergies, and that is extremely important. Our values begin with our people. It stands for advocate, which goes right back to our mission, and that stands for accountability, dedication, vision, openness, compassion, advocacy, teamwork, and excellence. So we're going to move from that, talking about Signet, which is not why y'all signed on today, to introduce our panel discussion and get into really talking about some of these issues and how it's impacting your systems on a daily basis. So we're going to move to question 1. And we'll open this up for both panels, certainly, but as Medicaid and Medicare reimbursement models, looking at our reimbursement environment, we know that some of the major issues are protecting margins and financial sustainability, because as I heard a very wise woman say once, no margin, no mission. Looking at workforce shortages, engagement, and retention. How do we do this in that ever-changing environment? Continuing to maintain patient access and quality outcomes so that patients can actually access the care they need at various doors in all of our systems. Funding growth, innovation, and capital investments. So these were some of kind of the large buckets that we hear from healthcare leaders across the country as some of the bigger challenges.
So this is a polling question, and we'd love to have some response from the audience as far as what you consider to be the greatest challenge that your organization faces. Which of these questions? I'm sorry, we moved on from the poll question. I thought that was a
I'm trying to get back to it. I apologize, but
okay.
There it is.
We'd love to know what you think.
So if people want to take a minute and type in your issues and specific questions for Michelle and Michael. That's better, thank you.
So you should have the ability to click on your answer right on the screen. Okay.
So before we move to any questions, Michelle or Michael, do you have any comments that you would like to make to people's response to this? I mean, it's pretty clear what the overriding largest pain point is.
Yeah, I think it's what you would expect. I mean, if you're running any organization, obviously protecting margins and financial sustainability is obviously key. It's not the only thing, but it's obviously the major priority, especially now.
Michelle, anything from your perspective?
You know, financial headwinds, I think, is what we are all worried about, particularly with when HR 1 became law. And I suspect that will be part of a lot of our discussion this afternoon.
So moving on to the first actual question for the panel, which really ties right into that major issue of, you know, how do systems keep moving forward in a way to do all these things with often shrinking margins? As Medicaid and Medicare reimbursement models continue to evolve, what do you see as the most significant challenges healthcare organizations will face over the next 3 to 5 years? And how should leaders prepare for them today? Which one of you would like to?
Let me start with this. First of all, this challenge is not new. You know, it's a constant. I mean, I don't think any of us can ever remember a time when the reimbursement and financial stability was not one of the key issues that we were all concerned about. You know, healthcare leadership is not for the faint-hearted. So this is something that's going to get more severe and more intense over the next couple of years, in my view, because of the demographic changes. And of course, some of the lack of coverage and access issues that we see resulting from some federal policies recently. But on the aging issue, we're going to face an aging tsunami. We're in it at the moment, and that's going to continue to create more pressures for us with regard to chronic illness, et cetera. And the obvious thing that everybody that's listening knows very, very well is that government payers, especially Medicaid, do not cover the total cost of care. So in most organizations, anywhere between 55 and 65% of the revenue, and in many cases it's much more, come from government. And as government reimbursement shrinks and some models change in terms of how they pay you, this is going to be a continuous issue. So the question is, what do you do about it? Well, let me say a couple of things. What I think is very, very important, especially in difficult times for leadership, is to stay positive and optimistic. Attitude matters. as a leader, what you say is listened to, and how you act is observed. So, and there are no employees that wish to listen to a leader who is constantly negative and talking about how bad things are. It is our job as leaders to try to figure out how to work through these difficult circumstances. So being optimistic to me is very, very important. Remember what we did during COVID. So when you compare what we did during COVID against some of the issues that we're facing now and will in the future, you have to put it in somewhat perspective. The second thing I would say for leaders is that as you're looking at the financial implications, is that you stay focused on the mission, that you don't lose sight of the sense of purpose of the organization. Because it's very easy just only to think about finance and to forget the other aspects of what it is you do in the organization. And if you want to have and develop loyalty among your employees, you've got to be talking about things other than just finance. So focusing on mission is important. The third thing I think every good leader is asking now is, what can we do differently? How can we organize differently? Can we deliver care differently? To what extent should we be doing more on the outpatient side rather than on the inpatient? How do we manage on the floors better? And that's a question that everybody on an ongoing basis has to be continually asking. And two other points. One is that even in difficult times, you have to continue to grow. You have to continue to build and expand, in my view. You have to continue to take risk. It is very easy in difficult times to become risk averse, and that's dangerous. So you have to take risk while still managing the finances. And the other part of that, in my view, is that, and this depends upon the type of organization you have. This is easier in some organizations than in others, and that is to continue to build alternative sources of revenue. What other businesses can you engage in? We, for example, at Northwell have a whole series of other not-for-profit businesses that we have created over the years as a way to offset against the continued reduction in government payers. But as I said, it is easier in some organizations than in others. And the last thing that is very, very important from my view in a situation like this is constant communication with staff. You have to, close the gap between the C-suite and the front lines. Staff know what's going on, but if you don't explain to them the realism of what's going on, and if you're not positive, it leads to all sorts of confusion and a lot of negativity. So communication. Employees will change with you and will be willing to take difficult circumstances in stride if they know exactly what it is you're all about. So I would say the next couple of years are going to be a little bit tough, but my view is if in a leadership capacity, you're judged by how you deal with tough circumstances. You're not judged just by how you deal with things when things are good. So, and it is no different than what we've been dealing with in the years past. We just have to bring our best intellect, our best sense of caring, our best focus on purpose, and making sure that our employees, we bring them along on the journey, because if you don't, you're going to have a lot of problems internally. So I would say be positive, be upbeat. Everything is achievable, everything can be fixed. And I believe most organizations will ride through this well and do well during a difficult period of time.
Thank you so much. I mean, that really resonated certainly with me, and the constant communication. It makes me just think about just be present, right? Be present, be very present, not leading from a chair. Michelle?
A lot of those answers resound with what I would add as well. Certainly looking as you have your eye focused on the mission and you proceed with a positive attitude, you need to become the leader that people will follow. And in doing that, there's some tough choices, and there are some areas in which we really need to look. We need to look at our care delivery. We have this traditional model. in which most of our care is delivered on the acute side. Even with the addition of, value-based and preventative health, we are still fairly primarily funded by DRG, which is more of a sick care model. We really need to look at how we deliver care. Investing in those things that we already started with COVID, and I think that some of it has continued and some of it has died off a bit. But that top of license practice, what we're doing in virtual care, what we're allowing technology to enable, although remember that technology is not going to fix a broken process. Technology will just make your broken process technologically broken. So we really need to look at how we enhance and reframe our workflows. And how do we do that without compromising quality? Certainly the workforce sustainability that Michael also talked about. No reimbursement model, no matter how much or how little money you have, can succeed without an engaged workforce. And those folks at the sharp edge, they have some incredibly clever and profound ideas on how things can be different and how things can change. And we also know and have been hearing a lot these days about burnout and turnover and staffing. If there's anything we learned from COVID, it should have been that if we don't have healthcare workers, your hospital doesn't run. We need our staff to be engaged, and we need that staff, and we need to invest in them and create environments where those leaders can thrive and to help us to lead through the financial headwinds and the other headwinds that are in front of us. And I think that organizations that can do that, reimbursement is, stop thinking of it as a financial challenge. It's a transformation challenge. How do we do this differently because we're being pushed to do it? Which leads me to the other thing that I think technology can provide. It should provide and strengthen data and analytics like it never has before. To take our data, and most of us have loads of data, but do we really have knowledge and do we really have wisdom emerging from that data? So what can we learn from it as far as what does that data tell us what we need to do and what we need to pay attention to? And can we predict utilization? Can we measure our outcomes, and can we intervene earlier in order to be more proactive rather than the current sick care model, which we all basically still practice within, to be honest?
Yeah,
let me just add one thing here, Joe. During COVID, Michelle mentioned COVID, and I mentioned it as well. But during COVID, at least in our environment here, we benefited enormously, and it allowed us to be extraordinarily creative because the governor relaxed a lot of the regulatory shackles that are sometimes put on us to be creative. And so when a lot of the regulatory things that are not necessary, I believe in regulation, but there are certain things that we don't need anymore. So during COVID, we could be very entrepreneurial. We were able to do things quickly during COVID that under normal times would take us a year or two to get done. And I do think that is another piece of the equation here, is to make sure that the regulatory bodies give us the freedom to be innovative and not tie us up in knots all the time, unnecessary stuff. And the other thing to watch during a period like this is bureaucracy grows in every organization all the time. There are always inefficiencies. And so the opportunity right now is to look at how you flatten your organization, how you can take out that which is not necessary to continue it, but not doing it at the expense of the revenue side of the picture or the growth side of the picture. It's very easy when things get tough to begin, I'm going to solve this by cutting. But you're not going to cut yourself to success. You've got to grow to success. And if there is too much of an emphasis just only on the cutting side of the equation, you're going to lose the commitment of the employees. You're going to lose the loyalty, and you're going to make bad decisions that while they look good in the short run, they can be terrible in the long run. Yeah,
no, that was really some great points. I'm going to move us to question 2 out of respect for time. I do know there's a couple of questions, and if we can, we will get back to them. I do see them. Question number 2, healthcare organizations are under increasing pressure to protect margins while continuing to invest in patient care, workforce development, and growth initiatives. And really this talks to certainly, Michelle and Michael, what you were both just talking about, right? Focusing on the growth, making sure your workforce, obviously never forgetting patient care. How do leaders determine where to invest, where to optimize, and where to make those difficult trade-offs?
So I can start with that.
Thanks.
While remaining positive, resources are finite, and we have difficult choices in front of us. So I think the question becomes, as you're looking at where you choose to invest, is, will this investment improve outcomes? Will it improve the patient and the provider and the staff experience? Will it reduce costs? Will it preferably accomplish all three? And those three things, exceptional patient outcomes, a healthy workforce, and financial performance, which we typically handle kind of separately. There's a department for each one of these in most hospitals. They are becoming increasingly inseparable. So we really need to look at how we bring those together. What are those investments in workforce? And what are those choices that we make? What are the difficult trade-offs? When I look at what certain organizations are doing, the word keeps coming down. It's hard. It's the central limitation here is efficiency. You have to be more efficient. You have to be more efficient. Efficiency has a ceiling, and at some point, when does it stop being efficient, and when does it start being something pretty close to rationing in the name of operational performance? So I think we need to look at what do we do and what are the choices that we make, and it really goes back to our mission. It goes back to, what are you looking at providing? What are your non-negotiables? I think about those are some of the difficult trade-offs that your mission will hold you more towards the center of where you need to be. You need to protect those non-negotiables. You need to protect emergency care. You need to protect obstetrics. You need to protect care coordination for high-risk populations. Those are some of the same recipes that we've been following. Those community health partnerships, so that you get more in the front of care rather than back into the sick care space. Those things cannot be optimized away. So I just think that as you're looking at patient outcomes, a healthy workforce, and financial performance, those need to be thought of as a collective as you address the decisions that you have to make. We can't, Dr. Dowling said something about the bureaucracy that is added in organizations. The processes that add complexity without adding value, you really need to look at those and scrutinize whether or not those are things that you need. But certainly there are things that we can do now that we have too much of. We have way too much administrative burden. We have way too much clinical variation. We have workflows that are ineffective. We don't leverage technology well in general. I think places like Northwell do a better job, but we need to be in a better space. Healthcare is pretty much a laggard as far as utilizing AI and technology in the ways that it can be utilized. And there's a lot of fear around how that is used. We need to actively introduce our staff in the ways that AI, with examples on how AI can be effective, rather than letting that space of, I don't know what this does, therefore I'm going to fill it in with my own fear. We have to eliminate that and really be proactive in helping our staff to understand that these things can help us, but we really do need to protect we really do need to fix our processes, because you put technology on top of that, you just have a broken technology process.
Sure. No, great comments.
Let me just make a comment. I would agree with Michelle. I mean, you got to make sure that you focus on the patient care issue, number one, that you protect the safety and quality and protect access. Those are key. I mean, that's our core customer base. That's why we're in business. And so rate those priorities, and make sure that you don't injustice to the patient as you make all of these basic cuts or changes. The other thing I would say that I'd like to add is that I think there's a great opportunity, and it goes back to the first question as well, is to how to figure out to eliminate a lot of the unnecessary bureaucracy that exists between payers, between providers and payers when it comes to insurance coverage, the whole issue of denials, and the whole issue of pre-authorization, the unbelievable amount of paperwork that goes back and forth. At most organizations, including big organizations, if you're on the provider side, that are in many cases thousands of employees who do nothing else but try to figure out how to get paid after the denials by the insurance companies. There's an opportunity here both on the insurance company side and on the provider side to do something to ease that whole process, because it is a bureaucratic nightmare. Now, AI can help to some extent here, but this requires an unbelievable level of cooperation and partnership between the payers and the providers to say, we can do better than what we've been doing over the years. We can solve some of these inefficiencies that exist between us. And I think it's an area that should be focused on as we go forward. There's been efforts on this over the past. I've been involved in quite a few of them with limited success, but I think there's an obligation on both sides to do something here, because otherwise somebody else will come in and do it for us, and including government here, because there is an increasing move towards, in many places, towards a discussion around single-payer healthcare, which in my view would be absolutely disastrous. Therefore, I think it's incumbent upon the payers and the providers to figure out how to reduce inefficiencies so that we can save some money to put more money into direct patient care.
That was such a great point. And for sure, that, and Michelle, when you were talking about just the care coordination, right, the high-risk populations and the importance of that, and the importance, so I go back to your point just now about the payer-provider, really, I would say partnership and a completely different, a paradigm shift, right? Of trust, of being able to sit down at the table and really look at what does it take, not just within the levels of care, but across the continuums to provide better care coordination for those high-risk populations that are usually also the high dollar spend, both on the payer side as the government side, the provider, and all that amazing thousands of FTEs that go into sort of what you were talking about, just that prior auth and then chasing denials on the back end, and how much better that could be spent on the patient care and care coordination side, so that people don't wind up back in the EDs quite as quickly with that exact same problem and a burden for everybody. So that really were some really great points. I thought, hold on, there was a question 3 and then. So anyway, I believe we're going to have question 3 and then do another poll at that point. So, but I'm having there's question, hold on. There's question 3, okay. I just got a note that we're going to do question 3 and then the poll. So question 3 is, workforce shortages and rising labor costs remain major concerns across healthcare. How are organizations rethinking workforce planning, care team models, and employee engagement to maintain quality, improve retention, and support long-term sustainability? So kind of, we talked about a lot of the philosophies, but what are the how-tos? Which one of you would maybe like to take a stab at this one first?
Well, let me start by saying that the first thing you do is let employees know that they're the most important asset in your organization, and communicate that on an ongoing, regular basis. Organizations don't change, employees do. So you've got to get to the employees if you want the organization to change. as organizations are nothing more than a collection of employees. And part of this is to make employee investment a top priority. And I think it's never more important than now, given all of the changes that are occurring, including all the new technology that have come into play. So I'll give you an example of a couple of things that I've been doing over the years. To me, it all starts with recruitment of employees. So for the last 24 years, I have met every new employee that was ever hired at Northwell. And we typically hired about 250 people a week. So I would spend the first 3 hours every single morning with new employees, all new employees. And people wondered, why did I do this? Well, because I've always, as I said, they're the most important asset. And I would spend those 3 hours answering all their questions, explaining the purpose of the organization, explaining their obligations and their responsibilities, explaining what was appropriate and what was not appropriate in terms of behavior, and providing them with information about the opportunities that existed in the organization. Because we have inside Northwell, and many other organizations have similar things, we have a major center for learning and innovation, which is like the equivalent of an in-house corporate university, which provides optimum opportunity for people to continue to grow and expand and educate themselves on new models and new career and new skills. I would also spend an awful lot of time with employees, small level breakfast, dinners, etc. Because you want to engage employees. You want to, listening is a big part of leadership. Is listening to what employees tell you, asking them and them tell you what their desires are. Because I've always believed that employees don't want to work for an organization; they want to belong to something, and you got to create that sense of belonging and followership. And lastly, talking about workforce shortage, I don't believe there is such a thing. There is no workforce shortage if you do in the future, if you do something today. And for every organization out there, if you look around your environment, you have hundreds of high schools. And these are high schools and kids in these high schools wondering what their careers are going to be like, wondering where they should work, wondering what opportunities exist. So we should be working with these high schools in a major way, which we're doing here at Northwell. We're working with about 60 high schools and spending enormous time with them. In fact, what we did a year ago is we started and created our own high school. So we have the Northwell High School of Health Sciences, where it's a New York City school. It's the result of a challenge grant from Michael Bloomberg. And we modified the curriculum to focus on nursing, mental health, medical administration, etc. And all of those students in that school, and there will be 1,000 of them over the next year or two, all of those students are future employees. So if you sit around wondering about your stats and not actively engaging with the massive cadre of new potential employees that exist all around you, then you're going to have a workforce shortage in the future. But if you engage with them, get them involved, and I spend quite a bit of time on this, and I've spent quite a bit of time in this high school, which is very inspirational. These are kids now who say, I want to be a PA, I want to be a nurse. And we provide the opportunity for them to proceed with their education, etc. And we do this as part of our medical school as well. So to me, it's making the employee investment a priority. It's engaging directly with employees. It's working with high schools and other colleges to create the new workforce that you know you're going to need. Instead of complaining and whining about it, my view is do something about it. Because if you just sit around waiting for something magical to happen and come in from outer space to fix your problem, it's not going to occur. The potential is all around us. All we have to do is take advantage of it and use the opportunity. So to me, the employee engagement and the employee training now is going to be very, very, very important, given AI and everything else that's occurring. We've got to train differently. We've got to teach differently. We've got to learn. We got to make sure we know how people learn differently today than the way we learned when we were coming up years and years ago. So those would be just some general comments that I would say.
That's great. That's really wonderful. And meeting everybody employee and doing dinners. I mean, it just cuts across all kinds of issues. Michelle, thoughts?
Yes, I do. So Dr. Dallin talked about how you start with recruitment, but the magic out of his approach is retention. Retention is, in the end, much more impactful, but it starts with that meaningful engagement at recruitment. Replacing these experienced clinicians who know your processes, who know your mission, and who know your culture. Imagine how destructive that is. Imagine how it impacts quality. So being able to retain that workforce is just so important. And that is why the engagement is so important, as well as that leadership development, so that leadership can continue to engage and to make sure that we are retaining our employees. I do have to go back to one of the things with employee engagement is really looking closely at the role that technology and AI can play. Look at the documentation burden that physicians have, that nurses have. I once worked for a CMO who told me an interesting story. He said, if aliens were to ever visit our planet and they ever looked at a hospital and said, I wonder what happens there, he told me that he thinks their conclusion would be that nurses take care of computers, and for some reason, people sleep there. With that, which was a little funny to hear, you walk through the halls and you see a lot of people taking care of the computer because of those horrible documentation requirements. Imagine the friction that could be removed just by freeing up more of that care and to take care of patients. There are folks that are concerned about AI replacing clinicians. People used to have jobs digging holes. And then somebody built a truck that could dig holes for you. So what did those people do? They learned how to operate the truck. So there's a continual progression that can happen here as far as the opportunity that it gives people that do the jobs now and what those jobs might look like in the future. At the end, it's how do we make, and Dr. Dowling, you are so right, how do we make the work more meaningful? And how do we make the teams feel more meaningful and more effective in that work? And how do we help them to see their success? So vitally important.
And I just would add here that there has to be a direct connection between the C-suite and the front lines here. Employees need to know who the CEO is. And the CEO needs to know more about the employees at the front lines. There's often a disconnect between the bottom and the top here, and I think we got to close that gap. And people want to belong, and the more I spend time with employees talking about the meaningful work that we do, the sense of purpose of the organization, the involvement that we do in the community, and that helps with retention. People want to belong to an organization that does good things and goes above and beyond, that is innovative and creative and entrepreneurial. That's what people are looking for. Plus, they're looking for the opportunity to grow and expand, and that's where your education and training comes in. But it's bringing the C-suite down to the front lines.
That's right. Well, those are really great comments. One of the audience members posted a question agreeing a need to invest in our invisible architecture and celebrate more than the visible architecture, and owning the engagement is key. How do you take the responses and share with the front line to ensure the voices are heard? Listening to you both as we move on to the next and to a poll, it really resonated, because one of the things we do at Signet is try and push decision-making down as far as we can. So along with the listening, not instead of, because listening, obviously, I believe is always key. And just that human connection, you can't underestimate what that does. People want to not only belong to an organization that has meaning, but they want to feel like you don't wind up in healthcare if you don't want to find some meaning in your work for the most part. And that's true no matter what somebody's role is in a healthcare organization. And I believe that helping empower and pushing decision-making down as close as we can to the patient care helps with the retention, because there's ownership then, and it's a shared ownership, and understanding, going back to the point about making sure all new employees understand what your mission is so that it's shared. So I thought that was really, really important. So we're going to move this to a poll now. I'm trying to find it. Marilee, if you can. There you go. Okay. So when we looked at the areas of looking to investment and making those difficult trade-offs, I thought that was very interesting, going back to how you both answered as our expert panelists, when you look at the workforce development, retention, and then technology and digital transformation, almost an even exact split. Any comments before we move on to the next question from either of you?
Just one general comment. We've got to optimize technology. I think there's a lot of opportunity there, but we can never optimize it at the expense of the human dimension of healthcare delivery. The real trick will be balancing the tech with the human. If we go too far in tech and lose sight of the human element of care delivery, we will be going down a path that's not going to work.
That makes so much sense. And as we move into question 4, it really reminds me of, going back to an earlier point you made, and something I believe strongly in as a healthcare leader: stay focused on that mission. Obviously, we need margin. Obviously, we need to be sustainable and keep growing. But if we stay completely focused on that mission and and let that be what drives us, because the technology is a tool to accomplish all the things we've talked about, it isn't the purpose, right? Question number 4. Healthcare leaders are increasingly expected to drive transformation while maintaining operational stability. What leadership approaches have you found most effective when guiding organizations through periods of significant change and uncertainty? And we have about 15 minutes. Go ahead. I'm sorry.
Let me be brief on this. I mean, leadership, in many ways, is all about managing paradox. Leadership is all about managing stability versus change, innovation versus status quo, centralization versus decentralization, the individual versus the team, today versus tomorrow. That's what leadership is all about. And so how do you deal with this? I go back to what I've said a couple of times, is that this requires, you've got to be very adaptive, but it requires focusing on the human element. It's communication. It's no good for the C-suite to decide that they want to go in a new direction if the people on the ground and your middle management and your first line supervisor and the people who do the care on the floors don't understand where you're going. So communication. I mean, it's being honest, it's being realistic, it's being clear about purpose. It's explaining to people why we're doing the following and what choices we are making. And I don't know that there is an alternative. You can't just, the days of command and control, of issuing a directive saying we're moving in this direction, now everybody jump in the new direction, that day is gone. Your employees today won't put up with that. You got to explain to them, and they will go with you if you explain this. If you explain it with a sense of realism, honesty, integrity, and truth. And so I know we're close to running out of time, but to me, the answer to this question is elevate the human dimension of what you do and deal with the staff on a direct basis.
I would add an additional thought. This question talks about transformation while maintaining operational stability. I would challenge you to think that transformation and operations are not competing priorities. Sustainable transformation only happens when you trust that the organization, when the employees trust, the staff trust that the organization can actually deliver. So they go hand in hand, they do not compete. So back to what Dr. Dowling said, do the staff understand, have you communicated with them clearly and in a compelling way why the change is necessary? Have you maintained the fundamentals? Every single person that works in a hospital is going to tell you that the patient comes first. So are we focused on those operational fundamentals, the quality, the safety, the patient experience? Again, with the staff, the best ideas often come from the front line. It comes from what I call the sharp edge. That's where it hurts the most, and that's where where the secrets of how to proceed are really revealed. And we talked a little bit about transparency. Leaders and their transparency don't have to know all the answers, but people are far more willing to support change when they feel respected, informed, and included. And sometimes a leader's answer is not having every answer, and being honest about the challenges that are in front of them.
That makes so much sense.
I would also say that the population of nurses in an organization, a key group, a key constituency that you focus on, because people listen to the nurses, including the physicians. So now you spend an awful lot of time with nursing leadership, because imagine, the bulk of care in a hospital, the bulk of influence in a hospital is driven by the nursing leadership.
It's 100%.
And I'm not saying that just because Michelle is on the panel. I believe in it, very strongly. And I spend an awful lot of time with nurses, and as everybody knows, a good doctor listens to the good nurse.
Yeah, 100%, right. And that's who's delivering more of the care. So really great discussion. I appreciate it. We're going to we're going to activate a poll question, and then we're going to proceed with question 5. So the poll should be active for people, and so we can get, because it has been some really good discussion. I'm sure there will be more points and that we'd like to cover. I'm going to move to reading the question, if that's okay, while all people are entering their answers. So question 5, technology, AI, and digital innovation are often viewed as key enablers of efficiency and growth. Where are you seeing the greatest opportunities for technology? And I know part of this, I think, has already been touched upon, but I'm sure maybe you can expound, both of you, to improve operational performance, patient access, and organizational resilience. I think that's a really terrific question. And, think about some of the discussion we've already had, where talking about, the chasing, I call it chasing denials, chasing, getting paid. But I thought the other point about really listening when we look at efficiency and growth, even on the technology side, really listening in a true way to our staff and to the people who are delivering the care day in and day out, and making sure that that's part of the strategic thinking, not for those of us, because the people delivering the care often have, I like that, the sharp edge, right? One of the things we had developed a software tool for some of our smaller hospitals that didn't have the internal resources to be able to measure and patient rounding, which is so important. And it was actually direct care staff that really had the idea, could we help come up with something? And it's been hugely appreciated, because number one, it was a staff idea. It wasn't ours. And, they wanted to round on their patients the same way as some of the larger hospitals, but they didn't have the internal resources to develop the tool to be able to really use that, going back to an earlier point that Michelle said in some other earlier today, of really using that data to learn from. So which one of you would like to dive into this one first? On the technology and AI, Michelle or Dr. Dowling?
up a little bit. I already mentioned technology a few times, and you know, some of the problems that are happening that people are talking about with authorization is because there's not enough human involved. You know, there are these recipes, I suspect, that are put into some of these decision trees, and a human isn't touching it enough. But I think the biggest mistake people make about technology when we go further is that it is not simply, and it is not only, a tool for automation. It needs to be thought of much more than that. And I think the greatest help, I'll come back to this, is decreasing administrative burden, because healthcare is a human experience. You're dealing with patients at the most vulnerable pieces of their lives, and they need the human interaction to survive those times in their lives. That is where we need to put the human beings, and let the documentation, let that be handled by something else that's clever enough to capture what you're doing, perhaps by listening to you in a room. I also think that there is some attention put towards how patients will engage with technology too. And I think portals have been great. Patients interact along the portal a lot, but we have to meet patients. We have to meet patients where they are. I think of the way the airline industry handles their ticketing and check-in. Now, not everybody likes to be on a plane, of course, but I think about the way they handle their ticketing and their check-in. So if you want to fly somewhere, you can either stand at a podium, there is a union there, you get your ticket, they give you your ticket, they staple it to a nice little folder, you give them their bag, they tag it for you, and it's off on the belt and it's ready to go. So there's the user that needs that. Then there's the user of flight services that maybe need a little bit less. Maybe they bring their bag up, and maybe they're willing to work that machine, Maybe they even have a digital ticket on their iPhone, So there's that group, and they're meeting those needs too without a blip. And then you have those flyers that, remember, they have to go somewhere next week. They're lying in bed, they pull up their airline app, they book their trip, and then they turn their light off and they go to sleep, and then they don't even talk to anybody in the airport until they reach the gate and they show them their virtual ticket. So the ultimate of technology, perhaps, in an airplane environment. But airlines are set up to accept and service all three examples of levels of technological use or non-use that customers have. And I think we need to, in healthcare, support that as well. We can't expect everybody's going to use the portal. We can't expect everybody to sit through a decision tree and automated press 1, press 2, press 3. So I think that is a nut that healthcare still has to crack. So we have to use technology, we have to keep the human in it, and we have to meet the patients where they are in their understanding and use as well.
I would just add that I think it's going to be integral to everything we do going forward, both on the clinical, the research, and the care delivery side. And I think if it used properly, we'll be able to relieve physicians and nurses and other staff of a lot of the mundane work that they do today, so that they can spend a little bit more time face-to-face with the patients. And so I think that would be the greatest benefit. Also, of course, it will dramatically help us expand remote work. Obviously, virtual care, a lot of what we do now face-to-face, I think some will be done remotely in the future, and I think we got to be just a little bit careful with that. But I think that's where it's going to evolve. And but I don't think it's just reserved only on the administrative side, as Michelle mentioned. I think it's very, very focused also, and should be focused, as we're doing here at Northwell, on the clinical side. I think healthcare is, contrary to what a lot of people say, they say healthcare is not as focused on technology as it should be. I'd ask anybody that says that to go into an operating room in an ICU and tell me whether or not we're interested in technology, because these are technology hubs when you go into an ICU or an operating room. So we're all for technology as long as it is done the right way for the benefit of the customer and the patient.
Those were really some great discussion. As we're coming up on the hour, move to questions and answers, so we can open the floor for questions from the audience. I know there were some that did show up in the chat. So we certainly can open it up now if people have questions for either Michelle Skolnicki or Michael Dowling, or just a question for the group. You know, I do see somebody had posted something. One of the last questions in the chat was, I am a nurse and I see a lot of new nurses going in it for the money. How can we change the wage competition from agencies? And that was something we really haven't talked about directly, although I think you both certainly, I think we discussed retention.
Well, I think that, yeah, I think that, you know, at least big providers can create their own workforce and create their own in-house nursing agencies, which we've done here, so that it drastically reduces the reliance on outside agency nurses. I do know that New York State made some changes recently. I forget the detail of it about how to resolve some of those differentials. But I think if you create your own cadre of nurses, develop your own, you know, and obviously when you're in a crisis situation, you have to go outside. But we've created at Northwell our own nurse agency. We are our own nurses because we have so many facilities, our own nurses float to different places. But it's an conundrum. It's a bit of a conundrum, and I think we just got to keep working on it.
Yeah, no, that's very well said. I would like to ask both of you if you have any closing comments. We are at the hour.
Now, I would just say leadership is about being positive. It's about you. Anyways, you're a conductor of hope. When things are difficult, what leadership is about is letting people know that we will survive, we will win. There is no putting up the white flag, that we are going to resolve this. And so good leaders don't whine, good leaders act. And I would say for everybody out there, you know, stop whining about the problem, because I think there's a little bit too much of it. And some people may not like me for saying that, but that's so be it. You know, it's not, a lot of people say, let the government fix it for us. We wait until somebody else fixes it for us. That's a failed strategy. And you don't get any respect for your employees when you go around saying, somebody else will solve my problem. It is our problem to solve.
Oh man, I love that. I will give credit where credit's due for it, but I'm a big one for borrowing lines from people. And I love that conductor of hope, because I do see myself as a catalyst and as a champion, certainly in terms of what my role is leading the organization that I lead. And so I love that. Michelle, any closing comments?
Just the last piece, and I'm surprised I'm saying this rather than Dr. Dowling, because we are very much aligned on this. Humans will always, always be involved in healthcare. Healthcare involves the state of a human being and how well they are able to participate in their lives. In those preventive moments, they participate fully. In those sick moments, they need help from another human who understands and can help them travel the path back to whatever healthfulness they can achieve. Invest in your workforce. Listen to them, let them tell you what's happening at that sharp edge, so that you can stay clear to your mission and delivered on the purpose why you entered healthcare in the first place.
Thank you both so much. Great discussion. Really, it was an honor to get you both here as panelists and share your thoughts and ideas and bring your expertise to the group. I'm going to hand this back over to Marilia, who started us off.
Thank you so much, panelists. Thank the audience for tuning in, for their comments, for their questions, and for their smiles. To be honest, we have seen some great comments on the team chat. A survey will pop up from Marcus Evans is just to know what other webinars would you like to create for you. At this point, I would like to thank everyone for their time, and hope we will have you tuning in on our next webinar. Thank you, everyone.